I am Kate Knowles. I'm an advanced nurse practitioner from Nottingham. So I looked into the way in which advanced nurse practitioners evidence their value and their cost effectiveness in the United States. And it was important because in the UK we're finding that increasingly we need to show evidence of this, and particularly in our business cases and as we move forward in the development of advanced practice. And I found out that advanced practice providers in the United States are certainly looking at the same question, and that's great. I was rather hoping that they had already established how to evidence their work, but unfortunately their health system has been very different in the past. The beauty is now that as they move towards a more value-based health system, they are beginning to ask the same questions. So it was great in the fact that one thing we were able to show that advanced practice in the UK is already doing some amazing work, and we are actually ahead in many ways, and we were able to show the States how to do things well, certain things well, and and also the other way around, we were able to see in which, how do I describe this? See ways in which we can evidence cost effectiveness more specifically. The highlight, there was no highlight to the trip on the basis that the whole of the trip was extraordinary. It was the most amazing opportunity that I have ever received professionally and personally in one combined package. This fellowship is now helping us both locally, regionally and nationally in terms of being able to establish business plans and planning for the future in order to evidence our work and ways in which advanced practice can help the healthcare system. For nurses, advanced clinical practice is giving the most beautiful option for career pathways clinically. So advanced clinical practice is a way in which nurses can develop their careers clinically. So if we can establish developed teams with good evidence of how they contribute both in value and cost effectiveness to the organisation, this is going to only go further forward brilliantly. When I came back, I felt very different in the fact that I felt a far more relaxed person. I had had the most extraordinary opportunity to consider life, work, and I really appreciated the opportunity that I'd had. I felt re-energised. My batteries were back to full, ready for an NHS winter, and I was very much aware that I work in the best place as a nurse. I love working for the NHS, and this fellowship gave me the opportunity to really explore ways in which we can make things better, but also share best practice across boundaries. We could share the way we work very well with the States and the opposite way around. On returning, I am already encouraging nurses, I'm encouraging everybody to apply for a Winston Churchill Memorial Trust Fellowship on the basis that this crosses boundaries across professions. What an opportunity, and why not? If you have a great idea, you're passionate about it, the only way to explore it further is by travelling, and you're willing to come back and share this practice, then you must apply for a Winston Churchill Fellowship. It is fabulous.